What is citalopram? Citalopram is an selective serotonin reuptake inhibitor family that aims to maintain a neurotransmitter level in the brain called serotonin and prevent its rapid breakdown in the enzymes. And of course, the availability of this neurotransmitter in the brain and its non-quantitative up and down leads to maintain mood stability and not being disturbed. What are the uses of citalopram? Although the first use of citalopram is for depression, it can be used medically for both of the following. 1. Obsessive compulsive disorder. 2. The withdrawal symptoms of the drug, especially wines and alcohol. 3. In the treatment of nervous discomfort. 4. For rapid intervention in the treatment of panic attacks. 5. For the treatment of premenstrual syndrome. Why is this medication prescribed? Citalopram is used to treat depression. Citalopram is in a class of antidepressants called selective serotonin reuptake inhibitors, SSRI. It is also to work by increasing the amount of serotonin, which is a natural substance in the brain that helps maintain mental balance. The following conditions are contraindicated with this drug. 1. A disorder with excess antidiuretic hormone called syndrome of the inappropriate antidiuretic hormone. 2. Low amount of magnesium in the blood. 3. Low amount of sodium in the blood. 4. Low amount of potassium in the blood. 5. An increased risk of bleeding. 6. Manic depression. 7. Suicidal thoughts. 8. Neuroleptic malignant syndrome. 9. A reaction characterized by fever. Citalopram side effects: nausea, dry mouth, loss of appetite, fatigue, drowsiness, sweating, blurred vision, and yawning may occur. If any of these effects persist or worsen, notify your doctor or pharmacist. Tell your doctor right away if you have any serious side effects, including shaking or tremors, decreased interest in sex, changes in the sexual ability, easy bleeding. Classification: Part 1 is therapeutic, which is antidepressants. 2. Pharmacologic, which is a selective serotonin reuptake inhibitors. What classification of drug? Citalopram is in the class of drugs called selective serotonin reuptake inhibitors, a class that also contains fluoxetine, Prozac, paroxetine, Paxil, and serotonin. Citalopram was approved by the FDA in July 1998. Citalopram is approved for treating depression. Citalopram compound, chemical and physical properties. Molecular weight 2 X log P3AA. 3 Hydrogen bond donor. 4 Hydrogen bond donor acceptor count. 5 Rotatable bond count. 6 Exact mass. 7 Monoisotopic mass. 8 Topological polar surface area. 9 Heavy atom count. 10 Formal charge. 11 Complexity. 12 Isotope atom count. 13 Defined atom stereocenter. 14 Monoisotopic mass. Experimental properties, chemical and physical properties. Physical description: boiling point 347 and 358. Solid: melting point 188 and 182 and 178 degrees centigrade. Color or form: solubility sparingly soluble, fine white to off-white powder, sparingly soluble in water and soluble in ethanol. Stability and shelf life stable under recommended storage conditions. Decomposition: when heated to decomposition, it emits very toxic fumes of bromides, nitrogen oxides, hydrogen fluoride, and hydrogen. Dissociation constants equals 9.78. Crystals from isopropanol. Vapor pressure equals 1.13 multiplied by 10 to 7 mm Hg at 25 degrees centigrade. Octanol or water partition coefficient equals 3.76. Cavat's retention index semi-standard non-polar. Drug interactions: taking citalopram with other medications may cause drug interactions of varying severity. It may cause drowsiness, slow breathing, or dangerous side effects or even death. You should consult your doctor before taking hypnotics, narcotic drugs, or some prescription. Cough relieving medications in addition to muscle relaxants, anxiety medications, antidepressants, and anti-epileptics. Here are some of examples of drugs that cause drug interactions with citalopram to avoid them. But this is not all drugs. Therefore, it is necessary to inform the doctor before adding or taking any new supplement, food, herbal supplements. Examples of these drugs and interactions include cimetidine, lithium, tryptophan, blood thinners such as warfarin and coumadin, other antidepressants, cardiac medications, psychiatric medications, triptan migraine treatment. You should consult your doctor before taking NSAIDs used to treat pain, arthritis, heat, and swelling. This includes aspirin, ibuprofen, naproxen, celecoxib, diclofenac, indomethacin, and meloxam, and other non-steroidal anti-inflammatory drugs. Using NSAIDs with citalopram may cause easy bleeding and bruising. Pharmacologic mechanism of action: inhibits the reuptake of serotonin in presynaptic neurons. Little or no affinity for dopamine, alpha adrenergic, histamine, or cholinergic receptor. Absorption: bioavailability equals 80%. Peak serum time from 1 to 6 hours. Onset from 1 to 4 weeks for depression. Full response may not be seen until 8 to 12 weeks after initiating treatment. Distribution: protein bound equals 80%. Metabolism: mainly via hepatic enzymes. Metabolites insignificant potency. Elimination: the half-life equals 24 to 48 hours. Dialysable: no. Renal clearance equals 66 ml per minute. Total body clearance equals 330 ml per minute. Excretion by urine equals 10%. Citalopram toxicity and irritation. Citalopram, unless otherwise specified, data extracted from RETEX, Register of Toxic Effects of Chemical Substances. Toxicity: irritation, oral, intraperitoneal. There are no significant acute toxicological data identified in literature search. Ecological information: very toxic to aquatic organisms. This material and its container must be disposed of as hazardous waste. Avoid release to the environment. Refer to special instructions or safety data sheets. Chemical formula and stereochemistry for drug citalopram. Citalopram contains a tertiary amine along with tetrahydrofuran ring fused to cyano-substituted benzene ring. The remainder of the molecule consists of tetrafluorobenzene ring connected so as to create a chiral center. Stereochemistry: isomers. Citalopram is a very special chemical because it contains two enantiomers, also known as optical isomers, R and S. S-citalopram is often referred to as escitalopram, but for simplicity, I will refer to it as S-citalopram. This means that citalopram has two stereoisomers, chemicals that have the same molecular formula and sequence of bonded atoms, but have different three-dimensional orientations of their atoms in space that are non-superposable mirror images of each other. One way to imagine this is to look at your right and left hand. Both are made of the same chemicals and have the same amount of fingers, however, have different orientations of those fingers. In this way, they are non-superposable mirror images of each other. One way to tell that citalopram has R and S enantiomers is to see the ABOs, RS, component of it. IUPAC name. When the enantiomers are in a symmetrical environment, they will have the same chemical and physical properties, but they will rotate bland polarized light. positive or negative, differently. Each will rotate equal amounts of polarized light, but in different directions, resulting in each enantiomers having different effects. This is one of the reasons why it is important that we understand the difference between these enantiomers. Chemical formula and stereochemistry for drug citalopram. Citalopram contains a tertiary amine along with tetrahydrofuran ring fused to cyano-substituted benzene ring. Stereochemistry. Isomers. Citalopram is a very special chemical because it contains two enantiomers, also known as optical isomers, R and S. S-citalopram is often referred to as escitalopram, but for simplicity, I will refer to